still understaffed, underfunded, and it's marred with corruption when it comes to hiring of health workers, as well as lacking commodities and supplies to take care of patients. Kenyans are still paying heavily from their pockets to access healthcare services, despite talks by the government to implement the elusive universal health coverage. Our reporter Beldin Waliaula looks at the hits and misses of devolution 10 years on.
A decade into devolution, the health sector is still facing a myriad of challenges. But before we get there, this is what has been improved on so far.
So in terms of the construction, the brick and mortar aspect of healthcare, it has actually been there's been a lot of investment in that across the country.
The country has more than 4,000 unemployed doctors and thousands of other medical professionals like nurses and clinical officers also without jobs, with county governments claiming they do not have the resources to hire more health workers.
We have counties that have not been paying salaries on time. You realize that healthcare workers go to work every day, but then the salary is delayed 2 months, 3 months down the line. And this has been, it's been recurrent in many of the counties.
What is not working? How can we be able to ensure that all these devolved units are at par? Why should we have Nairobi paying on time, the Taveta paying after 3 months, and another county after 5 years, the other one they're on strike?
World Health Organization recommends that one doctor should serve not more than 1,000 patients. Kenya has approximately 5,600 doctors against a population of more than 50 million people, meaning one doctor in Kenya serves 10,000 patients. Let's take the case of Tharaka Nithi County. Tharaka Nithi has a population of 400,000 people, according to the Kenya Bureau of Statistics in 2019. The county has only 26 doctors. 13 of these doctors have gone to further their studies, meaning the county now has only 13 doctors. So one doctor in Tharaka Nithi County serves more than 30,000 people.
About 4,000 unemployed doctors, and we have extreme shortage within the facilities, and this is because of devolution, and also because every governor has a prerogative to employ, and many will choose not to employ because they don't consume the services within those country facilities.
From the union side, our scorecard for the 10 years of devolution is that the management under devolution has failed. And when it has failed, then we must be able to sit back, consult each other, both sides, the management from the county, council of governors.
To solve the human resource challenge, medics are calling on President William Ruto to honor his promise of constituting a health service commission tasked with their welfare.
10 years down the line, and then the health access is becoming a difficulty. The cost of healthcare is continuously increasing. There's actual need then now to make a centralized body that will manage human resource. And this will ensure that annually we have employment of healthcare workers.
The country has experienced an exodus of doctors and nurses going to Western countries for greener pastures, a move that has left the country exposed.
Building the issue of universal healthcare in this country is a dream. It's a political statement. It's something that will not be realized in the next 50 years if there's no compact investment in healthcare, because healthcare can never be free. It's either the government funds the healthcare or the individuals fund it into the fund healthcare using their money.
I think the Ministry of Health has already seen that we are soon going into a crisis of medics. And now they are rushing to try and bring in a policy to bar medics from moving out of the country. And what you are telling them is that that cannot be a solution. You cannot prevent medics from seeking job elsewhere where they are appreciated when you don't appreciate them yourself. You don't give them employment.
Health financing is still a challenge. Kenya was a signatory of the Abuja Declaration in 2001, where it committed to allocate 15% of its budget to health. 22 years later, that is yet to be attained. Kenya only allocated 4% of its budget to health. A report by the Musimi Task Force in 2012 recommended that the health budget should be increased by 2% every year, but this has never been implemented. Lack of supplies and commodities is still a challenge to the health sector post-devolution, with counties failing to pay medical agency KEMSA. And now 26% of Kenyans have to pay out of pocket to access health services.
80% of the county hospitals in the country are totally don't have drugs, and this is because there's the counties are not being able to pay KEMSA, which will be supplying the drugs, up to the point that I think in February this year, the whole country, the counties hold KEMSA of 200 billion of the pending bills.
Devolution reduced hospitals' autonomy over key management functions, such as management of self-generated revenue.
And there are ongoing efforts to ring-fence the money that comes out of the health facilities, so it doesn't just go to the county treasury. Because if it goes to county treasury, of course it still has to go to treasury, but even if it goes there, it's still money that will be invested back to health. Because right now it's invested, it's just allocated, it goes into the basket for everything, and then health still gets its, you know.
The pursuit of universal health coverage is still in limbo. Experts argue that the Ministry of Health expects the national insurer, NHIF, to manage UHC. Yet, most employers, like the Teachers Service Commission, Public Service Commission, and Police Commission, all have private insurers.
Health insurance, if it's designed and implemented well, would move us closer, you know, to UHC, isn't it? But it needs to be designed well, and I think Kenya has a lot of experts. We design things well. The challenge comes in implementing.
State officers in this country are under a private insurance scheme. All the cabinet secretaries, the principal secretaries, the governors, Parliamentary Service Commission, even the Police Service Commission they put on private, even Teacher Service Commission, meaning the government is giving a private insurance over 100 billion. But again, the government is planning to run universal health care using NHIF. So how do you defund NHIF and say that you want to do universal health care?
A decade into devolution and the health sector is still limping. Universal health coverage is still a pipe dream that may not be achieved anytime soon. Beldin Waliaula, KTN News, Nairobi.
At least 64,000 households in Maralal town and its environs within Samburu County will soon have access to clean and safe water